Welcome to episode 58 of the TCM Board Formula series. Today we review the Huang Mu Dan Tang, Rhubarb and Moutan Decoction. Its category is Purge, Heat A, Break, Stasis A, Disperse, Intestinal Abscess. The memory hook is right lower abdominal pain, fever, constipation, and stasis signs are an emergency differential, not a self-care formula clue. The illustrated cover shows every ingredient in a separate tray, and the same cover returns at the end. This is TCM education, not individualized diagnosis or prescribing. The Huang Mu Dan Tang contains the Huang AAE, Mu Dan Pi AC per 1000 A superscript 1 registered trademark, Tao Ren AAEA with diuresis, Dong Gua Ren AACOEA, Mang Xiao AC. Its primary actions are purge heat accumulation, break blood stasis, reduce swelling and disperse an abscess pattern. Build the formula as a strategy rather than a list. Identify what the chief addresses, how the other ingredients reinforce or restrain it, and why this architecture fits the pattern better than a nearby formula. Organize the hierarchy. Chief, De Huang and Mu Dan Pai. Deputy, Tao Ren and Mang Xiao. Assistant role, Dong Gua Ren clears damp heat and reduces swelling. Envoy role, the combination directs purgation and stasis breaking to the intestines. This framework links ingredient choice to mechanism, helps explain dose emphasis, and makes the formula easier to distinguish under exam pressure. The target pattern is damp heat and blood stasis forming an intestinal abscess pattern. Look for right lower abdominal pain and tenderness, fever with constipation, a fixed mass or rebound type pain. The tongue is red with a yellow greasy coat. The pulse is slippery and rapid. Mechanism, symptom cluster, tongue, pulse, and treatment strategy must agree. One dramatic symptom alone is not enough to justify a formula. Differentiate the closest lookalikes. Tao He Cheng Chi Tang A lower burner stasis with irritability and constipation. De Cheng Chi Tang A bowel excess without a focal abscess pattern. Yi Fu Zi Bai Zhong San A chronic deficiency cold intestinal abscess pattern. First decide hot or cold, excess or deficiency, and exterior or interior. Then identify whether qi, blood, dampness, heat, food, or yang collapse is dominant. The feature that changes the treatment strategy usually decides the answer. Safety is part of formula knowledge. Possible appendicitis, perforation, or abdominal abscess requires emergency medical evaluation. Purgatives can cause dehydration and electrolyte disturbance. Blood movers raise pregnancy and bleeding concerns. Do not delay imaging, surgical consultation, antibiotics, or emergency care to try an herbal formula. Always verify ingredient identity, processing, product quality, dose, the complete medication and supplement list, and a monitoring plan. A classical formula name is never permission to delay urgent medical evaluation. 60-second recall. Formula, De Huang Mu Dan Tang. Chief, De Huang and Mu Dan Pai. Pattern, damp heat and blood stasis forming an intestinal abscess pattern. Actions, purge heat accumulation, break blood stasis, reduce swelling and disperse an abscess pattern. One-line hook, right lower abdominal pain, fever, constipation, and stasis signs are an emergency differential, not a self-care formula clue. First differential, Tao He Cheng Chi Tang A lower burner stasis with irritability and constipation. Say those points aloud before moving to the final ingredient cover. Here is the complete ingredient cover again. Name every tray from the on-screen ingredient list, then state the pattern, actions, top differential, and main safety warning. This concludes the Huang Mu Dan Tang. Save it for spaced repetition and connect board memory with qualified, safe clinical judgment.